The World Health Organization is meeting to discuss AstraZeneca's COVID-19 vaccine. The talks follow concerns that it may not be as effective against new variants of the coronavirus. South Africa has stopped its rollout of the shot. It says that the vaccine only provides minimal protection against the South African mutation. There have already been questions raised over the vaccine, with some countries refusing to give it to people over the age of 65 because of doubts about its efficacy. The vaccine is produced in the UK, where at least 12 million people have already received at least one dose. Ollie Barrett joins us now from London. Ollie, how has the UK responded to these claims about the AstraZeneca vaccine?
Well, UK officials are spending the day trying to reassure the British public about a vaccine which millions of people here have already received. They are pointing out that even if the efficacy is reduced with regards to the South African discovered variant, that if indeed the vaccine, as is considered quite likely, does still protect when it comes to the South African discovered variant against hospitalizations and deaths, then they think that that is pretty good news nonetheless, even if the efficacy is reduced when it comes to mild or moderate disease. The officials are also making the point that here in the UK, the South Africa discovered variant is still at very low numbers, according to the latest data. Thousands of people have been tested in the UK over the last week or so to try and find out exactly how widespread the South African variant is here. And thousands of test results have come back with only a few dozen positive cases of the South African variant. So UK officials are very positive about the fact that the Oxford AstraZeneca vaccine here in this country will be having a significant effect. As you say, around 12 million people have already received a dose of either the Oxford or the Pfizer-BioNTech jab here in Britain, and we're starting to see those effects on the daily numbers when it comes to hospitalizations and deaths, and it appears cases too. So British officials really doing their best to make sure that the British public is reassured as the rollout here continues, despite what we've been hearing from South Africa.
At the same time, Ollie, vaccine developers, well, they say they're confident that they can update the shots in response to those new variants. How would that work?
Absolutely. The Oxford team is one of many which is looking into doing exactly that. And indeed, the Oxford team believes that within weeks there could be an updated version of its vaccine which could respond better to the South African discovered variant. And indeed, the Vaccines Minister, Nadhim Zahawi, has been speaking today about this and about the idea that this may well be the new normal, in that vaccines are going to have to be updated as new variants emerge, as the world gets used to living with COVID-19 and raising the prospect of an annual booster jab of some sort against COVID-19 as mutations and strains and variants continue to emerge and spread around the world, hopefully at much lower numbers than they are at the moment. But officials here are pointing out that is not unusual when it comes to vaccination programs. We see similar each year with the flu vaccination program as well. Scientists here certainly are confident that this is something that the vaccine manufacturers can respond to, and can respond to pretty quickly.